Hello, my name is Sirin-Ayva. I'm a counseling psychologist and the psychology clinical lead for OneLife Suffolk. Today, I'm talking to Birgitte. Hello, Birgitte.
Hello.
Hi, could you please introduce you?
Yeah, so my name is Birgitte Wendon-Blixrud. I'm a senior therapist at the Wellbeing Service in Suffolk.
Thank you very much for that. So today we are going to talk about World Mental Health Day, which is on the 10th of October and celebrated by the World Health Organization just to raise awareness to mental health issues around the world. So I'm just wondering, it's been a really difficult time for all of us the last 18 months due to the COVID and the related issues. I'm just wondering, what are your observations regarding this? How was the impact of COVID-19 on people's mental health?
Yes, we've certainly noticed that COVID-19 has had a massive impact on people's mental health. We didn't notice it so much at the beginning of the pandemic. People weren't referring as much, but we were told that this was the case across the country. People were very reluctant to leave their houses. People didn't know what was happening. They were waiting to see. But in the last 6 months or so, we've seen a very big increase in our referrals. And we think people are now ready to start to tackle their mental health difficulties. I think statistically, it's about a 50% increase in mental health difficulties, I think we've seen in the population in general.
Yeah, it's a really huge number of.
Mm. Yes, and especially certain parts of the population, young people, the older people, people with chronic health conditions. I think these groups have been most impacted.
Mhm, mhm. But overall,
Yes,
all of us, it impacted all of us, and yeah, the increase is quite shocking numbers,
it
really.
is. It is.
So it is quite important just to look after our well-being, and there are some certain things that any of us can do just to in terms of looking after our well-being. What would you suggest to people just to in terms of looking after their well-being? What we can do?
Yeah, so we know that there's a lot that we can do. I mean, what the pandemic has done is that it has stripped away our routines, our normal activities that we would normally engage with and that would give us a sense of purpose and value. So what we would encourage people to do is to ensure that they have a routine in their day. They get up pretty much at the same time and they have engaged with their daily activities and they have a good night's sleep. They eat well. Exercise, we know, is good for mental health, but also to reconnect with other people. We know that in the pandemic, people were isolated. A lot of people weren't able to connect with the world outside. We were told to stay at home. But now we see people are starting to feel able to go out again and connect with others. And that's really, really important, as humans are born to connect with others. But we also know that there's other things that we can do. For example, re-engage with the activities that we used to really enjoy. But things like helping others, we know that can give us a great sense of purpose and value. Um, but also things like accepting the things that we can't change. I think some people really struggle with that. But if we can accept that the things we can't change, but we can make the most of the situation, but also to maybe change the things that we can change, that can also be very positive for mental health. As well as things like being grateful for the things that we do have. It's very easy to focus on the things that we've lost, and a lot of people have lost a lot of things. But if we can also be able to be aware of the things that we do have, that can be very positive for mental health. And if we need support, to seek support from people around us, um, that's also very important. And if the support that's out there from our friends and neighbours and family isn't enough for what we need, then perhaps refer to the services that are out there. So, for example, the Wellbeing Service is developed for people who have mild to moderate anxiety and depression. So it's a free NHS service. We can support people who have those needs, and they can just self-refer via our website.
That's really important. I mean, if we don't feel okay, feeling low, that's absolutely fine. That's okay. And there's no point of waiting until things get really complicated. It's okay just to seek help. It's not a weakness. On the other hand, I mean, it's important just to be aware of these, and if we can't cope with our struggles, difficulties, it's okay. We can seek help.
Absolutely. I think it's so important that people do seek help when they need it. It is nothing to be ashamed of. Most of us, most people will experience some level of mental health at some point in their lives. It's normal
Mhm.
to have anxiety at some point, especially when we have life stresses, such as the pandemic. It's been a massive life stressor for a lot of people. Um, so I think it's important that we do seek the support that's there. The help is there, and if people are struggling, if they're worrying a lot of the time, for example, they can't stop worrying. It's affecting their sleep. It's affecting their concentration, or they feel so down that it's impacting on their functioning. You know, we can help.
It's time to seek help. Yeah, if there is impact on sleep, day-to-day routines, yeah, it's time to
Yes.
seek help.
Hmm.
We, and we discussed what we can do for ourselves, for our well-being and mental health. What about helping other people? What you can say about how we can help other people
Hmm.
with their mental health?
Yeah. So using the support around us is so important if we're feeling low or if we're really struggling. And the way that we can support others is, I suppose, it's not rocket science, but be there for them, listen to them, be curious about what's going on for them, not be judgmental. It may be easy to show some judgment, I think, sometimes when people are struggling, because that can come out in some difficult behavior that people may not understand. So we may become more snappy, or more grumpy, or um, some people may become a little bit aggressive, and that's difficult for others to understand that as mental health difficulties. Maybe that person is really struggling. So rather than judging them, it's more helpful to just take a step back and be curious, and ask them what's going on,
Mm.
what's happening, can you tell me about it, and just being able to show that support can be very, very helpful. And also being able to seek support uh, to other services if that's needed, that they can support them in doing that referral, for example, or going to the GP. But showing that you're keeping them in mind, I think, is key. That you're thinking about them. So you can also do things like sending them a text message, or going for a walk with them, or doing kind gestures.
Mhm. These are also important for our well-being. They are helping to us to improve our well-being as well. So it's like a
Yes.
win-win.
Absolutely. Helping others and sharing, yeah, helping others can be so important for our own well-being as well. Absolutely. Good point.
Thanks. Thank you very much for all these tips, and thanks for taking our time just to join me today to talk about this, Brigitte.
Thank you very much, Abby.